Does your knee hurt, but you're not even sure what happened? You didn't fall over, you didn't have an accident, there's no injury or incident that you can remember, yet your knee is really sore. You're probably very active as well. You probably do a lot of running, cycling, or maybe you have another hobby or sport that you participate in, and you're thinking, why is my knee sore? Do you feel it the most when you go up the stairs? Or maybe when you're sitting in your chair flexed with your knee bent for too long. Or maybe you feel it when you squat down. If any of this is sounding familiar, then you probably have what's called patella-femoral pain. And I'm sure you've heard this before. It can be called patellofemoral joint pain, patellofemoral syndrome, runner's knee, jumper's knee, the lot. And you're thinking to yourself, but I'm so young, this isn't arthritis or something, isn't it? No, don't worry. If you've got pain at the front of your knee and you're aged anywhere between 20 and 45, it's most likely just patellofemoral pain. And in this video, we are going to go through what it is, why it happens, and we're going to go through the literature and we're going to make recommendations on what is the best form of treatment out there. Hello, my name is Paul and welcome to my summer kitchen here on the beautiful island of Sicily. I am a physiotherapist or physical therapist with training and work experience from the UK in the United Kingdom, and I've recently relocated here and started this YouTube channel so that I can educate you all on the most common aches and pains out there and what is the best things that you can do to cure them but prevent them in the long term. The layout for the video is very straightforward. We're going to look at why it happens and we're going to look at what treatment options are recommended based on the literature over the last 5 years. And then at the end, I'm going to share with you my 3 best exercises and practices that you can do yourself at home easily based on that literature. To better understand patellofemoral joint pain or joint syndrome, you really have to just start by looking at the anatomy and breaking down the condition itself. So if you think about it, it's called patella, which is your kneecap or your knee, and then femoral, which is your thigh bone, joint pain. So basically, it is pain at the front of your knee around the kneecap. That's it. It may be coming from the joint and it may be coming from the supporting structures around it, the ligaments, the muscles, or whatever. But basically, it is just pain at the front of your knee, sometimes down the left side, sometimes down the right side. And if we have a look here, you can see that there is the femur, here is the patella, there is the bone, and you can see that gap between them. And as we start to bring in the tissue, the joints and the ligaments, and then the muscles start to overlay there. And what you'll see here is a lot of the muscles really going in and connecting right in and around the patella. And this is what we think is one of the main reasons why this area gets injured. And when we bend our knee, the majority of the pressure is going to that area. Typically, when you go into a knee bend of greater than 50 degrees, that is when you start to put a lot of load or a lot of pressure on that area. And this injury is classed as an overuse injury, which basically means that you do too much too soon. If you imagine that your body is capable of handling a certain amount of pressure, of capacity, of exercise, of contractions, and you do too much too soon, that is what creates this pain and that overload. So that is why you typically see that it happens in people who do a lot of running or cycling or other kind of sports that require a lot of jumping and twist and jumping movements and running movements. And usually what you'll find is that they don't do an awful lot of the strength and conditioning side of things and focus more on the activities themselves. And even if they do regular gym work, they may not actually be doing it correctly and in the right way to continually build strength. Because as you decide to run an extra 5K or cycle an extra 10K, your knee muscles and your knee ligaments need to be trained appropriately. They need to be able to withstand the new forces and pressures and loads that you're going to put them under by doing that extra activity. And typically what happens is it's just an overflow, and that is what causes the pain, is your body just trying to tell you to slow down. And in my opinion, there is no other risk factor of note other than just doing too much too soon. It does show that it is more common in women, and maybe that's because men will naturally have bigger muscles there that they will be able to work on and train, and that naturally can support the positioning of the patella slightly better as it's subject to all those different forces and things like that. It also could just be societal and the fact that women maybe feel like they don't want to go to the gym, and they don't like, when they do go to the gym, they don't like doing the strengthening things. Like, just because it's more prevalent in females doesn't mean that it's because there's something wrong with being female. So I don't really like to push that. And all of the other risk factors tend to go in that direction as well. If you have naturally more turned in hip, for example, so it's rotated in the way, they also say that that is maybe going to increase your risk, because it means that your hip muscles are a bit weaker and it's going to put more pressure on your knee. And also, if you have a kneecap that's quite hypermobile and it moves a lot when you do things, when you get up, when you move, when you squat, that can also increase your risk as well. So they say. But again, I don't like to push this rhetoric because it makes the patient, you guys, feel like there's something wrong with you. And as we'll see from the literature, it's not really got anything to do with that. And it's got to do with a lot of more other simple factors that can help most of the time. And then these things are there in extreme cases because some people do have really, really significant alterations to their body naturally. But most of us have lots of little quirks. There is no perfect skeleton, there is no perfect positioning. So first things first is, do not think that there's anything wrong with you. There's probably just some simple tweaks that you can make to help solve this problem. Before we go over the literature, I'd just like to ask you all, if you are enjoying the video, please like and subscribe to the channel. I'm going to be posting 1 to 2 times a week on all things pain, injury, recovery, and living a healthy lifestyle. So if you have something that you want me to cover, please let me know in the comments below. If you know someone with this type of injury and this type of pain, send them the video, send it around. I would really, really appreciate it. And now let's just go over the literature. So what I did was I went through the literature over the past 5 years. I've left a link in the description if you want to open that table and have a read at some of those papers yourself. You're more than welcome to. What I tried to find was systematic reviews. These are the best because they basically take all the individual studies and bring them together and put all of their results together and analyze them to get better results. Why? Because physiotherapy studies usually only have like 20 people in them, like 10 in one group, 10 in the other. It's really, really difficult to do a physiotherapy study and compare an injury and a treatment and a control, at a large scale. It's just not very feasible. We're all doing things. So yeah, we do these systematic reviews. We can pull everything together and get a better view for the general population so that we can actually make recommendations that are more robust and strong. So looking through the last 5 years of systematic reviews, it was clear that there were 4 things that look like they are effective. Strength and conditioning around the hip and the knee, education on the injury and how to manage it yourself, kinesiotaping, which we'll talk about, and then finally mindfulness training as well, which we will all go through all 4. Things that didn't really come up were injections, steroid injections to help deal with the pain. If any of you have ever had that, let me know. And also surgeries. This is not something that we recommend for this type of injury anymore. It is gone. It is not the thing to focus on. And then also manual therapy. And just purely because there is no need to do any sort of deep tissue massage or anything like that in this type of situation. It is a clear overuse, overtraining injury, and the focus should be put there. And when we look at strength and conditioning or exercising as a whole as a treatment, we see that there are a few overlaps in that a lot of them, yes, suggest strengthening exercises. Some other ones do some stretching and strengthening. But overall, if you do strength, you're going to help reduce the symptoms and then help prevent the symptoms in the long term. However, what's come up in the last five years or so is that you should do knee and hip strength. And this is the best way because there's been a few systematic reviews that have shown that if you combine hip and knee strengthening, you have better results, i.e. you reduce the pain and you have a better function than if you just do knee strength alone. So that is one thing that is recommended now, is that you do both hip and knee strengthening. Why? Well, a lot of the theory is that when your hip muscles are weaker, that puts more pressure on the knee and that causes it to be sore. However, that's a bit too complicated and you can't really prove that your hip muscles are weak before and then you run and then that's how you get the pain. So we're not sure if there is any correlation there. And the other thing is something that I alluded to earlier, is the biomechanics, as we call it. So some therapists will argue that if people's hips are naturally more internally rotated, that will mean that their bum muscles are usually a bit smaller and a bit weaker, and therefore they are more likely to develop patellofemoral pain when they do things like run and jump and squat. And again, I like to come away from this rhetoric that there's something wrong with you as the patient. It's very difficult to prove that on its own is a reason for the pain, because we all have discrepancies. We all have issues. You'll find that most therapists sitting there telling you that your hip is internally rotated and it's causing you your knee pain will probably have an internally rotated hip themselves, and they run more than you do and they don't have knee pain. So it's not a one size fits all. We're all very different. So it's not necessary to focus on that. The thing to focus on is that the right strength and conditioning programs can help alleviate the symptoms and can help you get better in the long run. Similarly, there was another review that looked at ankle and foot positioning. And it was basically saying that if your foot is more out the way, so what we would say it's pronated, if it's more out that way, maybe your toes point to the left or to the right more than they do to the center, that type of foot positioning again does something similar, and it puts more pressure on the knee, which means that you're more likely to develop that pain, and suggests that you do a lot of corrective exercises where you try and strengthen your foot muscles so that you can bring it into a better position. Again, same idea. That's very difficult to actually do, and it's a bit of a waste of time. We don't know for sure, and most likely you can just do general strength and conditioning of your entire lower body and you will get better results. And believe me, it is very difficult to alter the way you move. So some people will say that you need to watch your running gait and make sure you keep your foot in. But if you've been running the same way for 20 years or so, changing that habit is going to be impossible. You're going to be concentrating so much on trying to keep that into the position. You're not even going to pay attention to the run itself. You're probably not going to enjoy it. And it's going to be super, super frustrating. And it may help the symptoms 1, 5, 10%, but it's not going to be a complete game changer. Instead, you should just focus on a robust strength and conditioning program that gradually gets harder as you do more exercise. And I think as therapists as well, we should be pushing that more than saying to our patients, it's the way your body is positioned. That is your problem. The other things that the research were suggesting was actually kinesiotaping. And basically what they were doing was they were putting some tape around the kneecap and pulling back up on the quadriceps muscles in the thigh for people who had this type of pain. And they were noticing that in the short term, it helped reduce their pain when they had flare-ups. And even in the long term, six weeks later, it was actually helping still to keep the pain down. In the middle part, 1 to 4 weeks, it wasn't really helping them too much. So kinesiotape can be nice. If you like it, if you have it, if your therapist has it, you can use it. Again, in these studies, they were still doing strength and conditioning exercises, so keep that in mind. Now, obviously, how does that work? Why does tape make you feel better? That's the interesting thing. Kinesiotape, the people who created it in Japan, will tell you that it's because it basically acts like the muscle. So when they put it on the skin, it's creating that friction and it is helping the muscle do what it would normally do, even though that area is pain. And when it's in pain, it's typically not working as well and not producing as much strength. So basically, they're saying that this magical rubber tape is like putting an extra muscle on your leg. Now, I don't think that's true, but the power in it is that most people who like kinesio tape, they think that's what it does. So therefore, that's what it does. Our minds are pretty powerful. We see a lot of athletes and sports stars who use tape, and they're still performing. We see them covered in tape. So we think, oh, if we put that tape on, it's going to do the same for us. That is actually a super powerful effect. So I think it's okay to use, but you should be aware that most likely the effects coming from it are very minimal. And most of the reason that you are feeling better symptoms is because they have reduced over time naturally, and you are working on your strength and conditioning, and you are getting stronger. So you are doing the work. But you can still use the tape if it's possible. But again, because you have to buy it, you don't actually need to use it. The other thing that I thought was interesting over the last 5 years is there was a few studies that looked at mindfulness training. So essentially what this is different breathing exercises and sort of meditative exercises that you do throughout the day to try and recognize your pain. So to go a bit more inward, which is actually something that in the wider space is very popular these days. So I like this. I think this is a very interesting idea. And it's shown that it can help reduce the pain. So what people typically do is they sit and they close their eyes and they scan their body, go through all of the areas, noticing all of the parts of it, and then they get to their knee and they focus on their pain and they really feel it and they understand it and they score it, and they find that after a few minutes it starts to go down. They also tend to do breathing exercises where when they feel their pain increasing, they just do breathing controls. Maybe they do 4 seconds in, 7-second hold, 8-second exhale, and they just do that repeatedly, and they'll notice that their pain starts to go down, because obviously pain is a sensation. It is something that we feel. So it would make sense that if you can start to control your mind and control how you feel, then that will reduce your pain. So this is a great one. And obviously it just purely depends if your therapist is aware and is comfortable prescribing these things. But this is a really, really good one because again, it's simple, it's cheap. So that is what we want in healthcare. We want things that are simple and cheap. Those are always the best options because that's what keeps healthcare available for everyone. And those are the things that I've found from the literature. Let me know if you think I've missed anything. What treatments have you had that you found effective, or what do you normally prescribe if you're a therapist watching this video? Let me know. Is there any studies that maybe I missed as well? Because obviously I did a literature search, but maybe I missed some. So please, if you know of any interesting studies, please link them down below. And now we're just going to go through my 3 top tips based on that literature. So I think the best thing that you can do is to build the strength of your quadriceps and of your hip muscles. So we are going to go through 2 simple exercises that anyone can do at home. So I'm going to show you how you can actually grow the strength of your muscles without needing any fancy equipment, which can be very useful when you do actually have pain. So the first one that we're doing is the wall squat or the wall sit. So essentially, you're just going to go to the wall and slide down until you feel that pain in your knee. And then when you do feel that pain in your knee, you're going to come up an extra few degrees. And you'll probably find that you're nowhere near that 50-degree mark yet. And you definitely won't be down at 90. But that's where you're going to get to. And then all you do is you just sit. You count. Okay? And you count until you really feel that that quad muscle is getting fatigued. How will you know? It's going to start to ache. It's going to start to burn a little bit. And then how long that takes, depending on your symptoms, it could be 5 seconds, 10 seconds, 20 seconds, 30 seconds. Sometimes I sit at the wall for 2 minutes just to see how long I can do it. And then once you're done, you come off and then you do that again. All right. And then the other exercise that I am suggesting that you do is a bridge, a very, very simple bridge. But what you're going to do is you're going to hold it at the top so that you can really engage the strength of those muscles. So here you go. I'm lying flat down with my feet at this angle, slowly apart. And then as you can see, I lift my bum straight up, squeeze my bum muscles at the top. But you'll notice I'm holding it there. Again, you should hold it for as long as is comfortable for you. You want to find that balance between the pain of the injury and the pressure on the muscles. This is very, very important. So hold it again for around 5 or 10 seconds. If you think that's too easy, then what you do is you can bring your sore knee, the one that's the affected one, slightly further in. So just move your foot in. This is going to put more pressure on that leg to make it more difficult. You're going to use more of the muscles in that side. Again, lift the bum up, hold and see. Or if you're feeling really confident, you can do it with one leg up. And again, the idea is you want to hold it for as long as you can. Now, in terms of reps and sets, it's actually very straightforward to build strength. So what you want to do is you want to do 25 repetitions per week for that muscle group. That is it. Okay? So that means with the one wall sit is one repetition. So you need to do that 25 times a week. But what makes it a repetition is that at the end of that repetition, you feel the fatigue in the muscle. So you want it to be challenging. So you need to make it as challenging as you can without increasing your pain too much. So that means you could do 5 rounds of 5 in one day. That means you could do 2 rounds one day, 2 rounds another day, 1 round another day. That is all you have to do. And it's the same for the other exercises. So that is the best way to start building strength. And you can even do this by doing isometric holds, which is what I was doing in these two exercises here. So I'm using gravitate and holding the muscle as the way to build the strength rather than using additional weight. So yes, do it like this and just hold those isometric positions for as long as you can. And it really leads into my final tip, which will be to try some of these mindfulness practices. They're so simple and so powerful. So what I would suggest is the next time that you feel your knee pain is flaring up, I want you to get comfortable, sit in your chair, straighten that leg out a bit, so extend it a little bit so that it's not fully bent, and close your eyes and breathe in for a count of 4. Hold it for a count of 7. And then breathe out for a count of 8. And then once you've done that, I want you to think in your head, out of 10, how painful the knee is right now. Let's say it's at a 6. And what I want you to do is I want you to think, okay, I want to reduce my pain. So then you do it again. You do the whole process. And then when you breathe out for 8, you check. Is it still a 6? If it's still a 6, don't worry. If it's still a 7, don't worry. Just keep going. Do it for 10 repetitions and see if you can start to bring that pain down yourself. And if you do, let me know in the comments below. And there you go. That is everything that you need to know about patella-femoral joint pain syndrome. Runner's knee, jumper's knee, whatever. So what are the key things? Strength and conditioning is the gold standard here. It is an overuse injury, basically too much too soon. Increasing the training volume, increasing the exercise volume, increasing the sport or activity volume has caused the pain because your muscles were not prepared for that increase. Therefore, the best way to treat that and prevent that going forward is to just let the symptoms calm down naturally. And then when you're ready, really work on getting stronger. And the way to get stronger is to make sure that you follow the principles of doing the right amount of repetitions per muscle group and making sure that each repetition is challenging. As you get fitter and stronger, you need to make it harder. You need to increase your weight. You need to hold it for longer. You need to do more repetitions. You need to do more sets. But that's how you start. And then also, if you want to try something additional, you can maybe try some kinesio tape if you have it. But remember, it's just tape. So you're the one who's doing all the work. And equally, try something different. Try some mindfulness exercises. Try some breathing. Try bring that pain down with the power of your mind. And that is everything in today's video. Thank you. My name has been Paul. And remember, get stronger, live longer.